Atrial fibrillation, defined as dysfunction of atrial and ventricular contraction. Symptoms are usually shortness of breath, chest pain, or palpitations. Treatment. First, you can treat it with digoxin, beta blocker, or calcium channel blocker. Next, you can either use anticoagulation if the event is more than 2 days old, or you can do cardioversion if the onset is less than 2 days. The mechanism of action of atrial fibrillation medications are to inhibit the sodium/potassium ATPase. On EKG, you will see an irregular rhythm. You also see a prolonged PR or decreased QET, and there will be no P waves. Common risk factors that can trigger AFib are pulmonary diseases, such as COPD cardiac ischemia, like CAD or CHF rheumatic heart disease, anemia, hyperthyroidism, ethanol, and sepsis. You should order a transesophageal echo to rule out a thrombus. You should calculate the risk of stroke with the CHA₂DS₂ calculator.